think only Rajendra Prasad can do this, bringing the government and the public, but all who have the common, our vision is the same, that we shall have a healthy India, right? I think this is what we've been working for the last 10 years. The public or private healthcare players have been talking and has done some very significant things, and we just heard from both the Secretary of Health as well as Srinath as what things are happening. But the most important in health, we have made a great diagnosis. The diagnosis is that India's health challenges today are different than what it was, and then we need to go head on to see what can we do to meet these challenges. The first major thing where Rajendra Prasad takes a lot of interest is the disease management. You know, the NCDs is really has become a major threat for our country, and I'm sure there are many ways we're going to cooperate with the government, with the NGOs, as well as with the private insolvencies. When we first started this dialogue with the government maybe 10 years ago, every year the various private providers met together in different hats with CII, FICCI, then formed recently an organization called the NATAC to represent the entire healthcare providers to see how do we bring to highlight where the interaction should be. What can the dialogue lead us to? Lead us to how can we see this, what's so-called the iron triangle, the quality in healthcare, the cost benefit, and the access. I think this is what all of us are trying for, to bring this happen in every country and in our country. And we have also thought of saying, as Srinath said, we must learn from others. There is something that we all must realize. What we need to work at is, what's a good formula to tackle this major health issue that we have today? Is it the Western method? We must say we brought the best Western method. In almost every single disease management, we brought the best outcomes. In every single and every single technology adaptation was done by us. But if you look at the West, they have got their own pressure points in their healthcare. We have our pressure points, and the Africa and other nations have their pressure points. So I think it's time now, in a body like this, to look and see with the tools that we have. You know, the tools is the understanding. The second is like the digital that we have, and the tremendous experience. Like for example, what Srinath Reddy has done in Public Health Foundation. Yesterday we had a major dialogue on the sector training, on the training. With their guidance, the society, which is formed by CII, hopefully will train first more than a couple of thousand trainers with an idea of saying we'll be able to train a few million healthcare workers at all levels and at all places. So I think there is a great utilization of each other's strengths, and using the technology, I'm sure we'll be able to address this our challenge and probably give a solution for others. And this is, I think, what the world is looking at. The recent conference in UK, Global Health Forum, and a discussion with 500 delegates from all over the world. They said these are the problems globally, but for each country there is a different connotation to the pattern of disease or the severity of the disease. But what we need is, can we see a new thinking and from the dialogue develop different modes. So they gave out 6 different ways of tackling the major health problems of today. But I think what we need is the formulas to work and say what's relevant to us. How can we quickly ramp up on these? The first thing is to see, now that the diagnosis is made, how do we ramp up people to meet this? The government, as Mr. Desraj has very clearly said, they are clearly willing to put in money. We already have the training programs developed by the various universities, and most importantly, now tailor-made developments by Public Health Foundation. And the organizations have taken it up very largely, saying, yes, we're going to do this. I think what's really required is to see for the first time to forget this government, private, and NGOs and say, how do we all work together with a single goal? And this is where I think Rajendra Prasad has brought all of us together. And I have no doubt, having seen every single meeting, whether it's yesterday or tomorrow we have the Nat Health meeting, in all of these, everyone says we will want to play a significant role to see that we can bring that change, which is more relevant to India, and bring a solution which is much more accessible and cost benefit. I think these are the two things which is India is trying at. It's nice to say we will bring the best technology, but must be able to give it to our people. That's why to get an access. Srinath also mentioned, even our health secretary has mentioned, saying, why aren't we manufacturing equipment in our country? This is not today. Over the last decade, every time we represented to the government and gave, the various 10 commandments demands to the government, we constantly stressed one aspect was the equipment, that it should be manufactured, the cost should come down, and the various measures that need to be done. I think to some extent they have played a role, but we will not let them off. So it has always been the entire health sector that has been talking and interacting, but I think it's the first time when you heard them face to face. So when the government and the Public Health Foundation and the NGOs are together working, but please believe, the vision is the same. We all are here to see that how can we rapidly transform the healthcare system, enlarge the healthcare system to tackle the problems that we are facing ahead of us. We have these 3 gold medals. We have the diabetic capital of the world, cancer capital of the world, and heart capital of the world. I wish we take this and throw it in the ocean or close to me in the Bengal. But we all know that we need to find. So what we are talking about is yes, we need to address each of these problems, but can we address it from end to end? So whether it's heart or whether it's cancer, we're saying, can we start with bringing awareness in people? I don't know how many of you are going to watch tomorrow. One of our CSR programs is Billion Hearts Beating program. The NCC cadets are taking the pledge. Why did we go to NCC cadets? Because these are the people whom we want as future citizens of tomorrow. These are the people who are going to build the nation. So from that level, we would like to see that they keep themselves. They don't smoke, they will eat regular diet and control whatever problems they have, and most importantly, help us to import the yoga and meditation, so the relaxation techniques, and spread this to their families and to their community. And I think that's why we would like to address the pre-heart or pre-cancer problems, and then post the thing to cooperate with the NGOs and see. So I think we need work for the end-to-end, and there is no way that if you clearly cut ourselves saying this is the government role, this is the private role, this is the NGO's role, I think it's not possible. What is possible and what needs to happen is to say together what difference can we make and how can we make it urgently. But things are happening. As I said, as a cardiologist, I feel last 1 month we have treated more than 100 people with infectious, with acute coronary problems. So I think these things are coming on us. Maybe Srinath knows very well the data from all over the country, and also comparative with what's happening in the rest of the world. And on some of those, so that we need to use the power of Public Health Foundation, the power of our scientists, and our clinicians most importantly, to see how we can make a significant impact. And this is what we are trying to coordinate and say we are with you by forming the various organizations such as HCI, had a healthcare division, has a healthcare division, FICCI has a CHEM. All of them have continuously been interacting and did what they could, the entire health sector. We have not formed another focused organization called the NACL. Similarly, the objectives are not different. To see how urgently, how actively could we participate in changing or bringing better health for all our country. Our theme is simple. We need to achieve the theme saying, stay healthy. So that's what I think I must compliment with bringing the digital healthcare. Sangeeta is here. She has done a lot of it to bring, have 2 or 3 conferences where she brought all the players across the world to see how can IT make a difference in transforming healthcare. We need to look at it. We know it's happening. It's happening in all other fields. Today they are talking about even finance. Money is the most important thing. If that can be transferred through a mobile, I think it's good that we need to sincerely look and say what great things can we happen by using the digital strength in first improving the quality of care. Second, of course, is to see that we bring the cost benefit, and finally to give a lot of access. We have talked to the government, even Sam Pedrola, when he said that NKN there will be a note for every 6,000 people. I think we request Srinath Reddy to convey our proposal saying healthcare at large is willing to ride on that note to reach the last mile. Every single doctor is willing, private doctor, IMA has taken the same resolution. They are willing to participate. The healthcare providers, small, large healthcare providers are all willing to see how can they work on the thing. And similarly, I think in this service training program, we hope we will have an access to those notes so that quickly we can ramp up training a lot of healthcare people usefully, which I think is a crucial thing today. We have fortunately the funds which they have announced in the 12th plan, but what is needed is, and also the whole, how many hospitals need to be built, how many clinics need to be built, but I think it was necessary to build the number of people to handle this. But that is very, very crucial. And this is where I think the digital can make a very significant effort. I congratulate Rajendra. I hope we'll have many more things, and then out of these, you should be very clearly come out saying, this is what the government will do, further facilitate and regulate the healthcare delivery system. The most important regulation that we are all looking for is that the provider